True global security demands a response to public health challenges and their underlying causes. In today's world, new infectious diseases can spread rapidly across the globe. Misinformation causes panic. Panic measures disrupt society and damage the economy.
In September 2014, the United Nations declared the Ebola outbreak in West Africa a threat to international peace and security. 2 months later, violent clashes between security forces and residents erupted in Monrovia after Liberia's biggest slum was quarantined. The government said that the quarantine, later abandoned as a mistake, was imposed for both health and security reasons. Residents had already stormed an Ebola holding centre, and the government was worried about the risk of political instability. Pandemic influenza has terrorised humanity for centuries. The 1918 Spanish flu pandemic killed at least 3 times as many people as World War I. The risk of another deadly flu pandemic is at the centre of current efforts to strengthen global health security. Our ability to travel farther and faster in the modern world also heightens the spread of infectious disease.
Wir spüren, dass das globale Zusammenrücken, das globale Zusammenwachsen uns alle abhängig macht davon, dass die Gesundheit des einen auch die Gesundheit des anderen ist. Das heißt, die Leistungsfähigkeit eines Gesundheitssystems auf der Welt entscheidet über die Gesundheit anderer Länder, genauso wie über Sicherheit und Stabilität. Das heißt, nationale Eigenverantwortung und globale Mitverantwortung sind 2 Seiten ein und derselben Medaille.
In 2003, the global dissemination of SARS happened after just 10 people became infected. They all boarded flights before falling ill and caused outbreaks in several countries. In the end, the virus infected 8,098 people, killed 774, and cost the world economy close to $40 billion US. Also high on the political agenda for strengthening health security is antimicrobial resistance. It threatens to push us into a post-antibiotic era where common infections could become untreatable, routine surgeries life-threatening, and a bioterrorism attack more difficult to respond to. The risks are many and complex, and no country is safe. But successes have been achieved.
Improved public health within countries has a decisive impact on global health security. If we just look at Nigeria, thanks to the improved systems and processes it put in place to tackle polio, when the Ebola crisis hit, it was much better able to contain polio as a country than the other surrounding countries. So the global health security provided by strong national health systems can't be overestimated.
But how well prepared are we for the next crisis? And what might the impact be on a society or political system if a highly transmissible, highly deadly epidemic occurred? One where emergency workers and key responders are equally affected, and where the ability to treat the complications of the disease is dropping because antibiotics are failing. Is it reasonable to imagine that such a situation could lead to a major breakdown in law and order?
Every country needs strong systems to detect, report, and respond to outbreaks. We need engagement by all actors, including the security sector. By fostering better public health, we will boost our common security. Thank you. Danke schön.